Welcome to PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso. In today's show, we'll be talking about something that matters to all of us. Cham, the air that we breathe.
That's right. This is a factor that affects all of us, and millions of people now have bad air, as it turns out. Air pollution that is really affecting them.
Yeah, so we'll be talking about air quality. That's really what we mean when we're talking about air pollution. And we'll be talking about it at the local level, the national level, and the global level.
Yeah, joining us will be Dr. Naeher, Associate Professor in the Department of Environmental Health, and Adawa Ajapong, a graduate student in environmental health.
And Cham, you're also going to get to interview Femi Adatona, who is a postdoc in environmental health. And you'll also be speaking with Dr. Veena, who's our head of the Department of Biostatistics and Epidemiology here in the college.
So this is an example of how important environmental health is in the field of public health, particularly in this instance, where we investigate the air we breathe. To cover today's topic of air pollution, we have Dr. Naeher from our very own College of Public Health, Department of Environmental Health Science. Dr. Naeher, Luke, let's start with the basics. What do we mean by the term air pollution?
Cham, first, thank you for the chance to be on the show. I appreciate this opportunity. What do we mean by air pollution? You could go in a lot of different directions in that, but let me take sort of the U.S. path. There's a few episodes in the last century, 1930 in Moose Valley, Belgium, 1948 Denora, Pennsylvania, and then 52 in London, England, where we see air pollution events that have high levels of ground level air pollution. Some of those events, we don't even measure air pollution yet. But what we do see is number of deaths, 60 in Moose Valley, 20 or so in Denora, Pennsylvania, but then thousands in London, England, in the Great London Fog. Over the 20 years after that or so, that really sets the stage for how we think about and define air pollution in the States, ultimately leading to Richard Nixon, December 31st, 1970, signing the Clean Air Act. It's been amended in 1990, 2008, 1997, but that still serves as, really defines what we think about as air pollution here in the U.S.
So, what are the most common and most serious health consequences of air pollution that we may not notice? You were talking about these episodes where a number of people died in these locations, but of course health consequences happen all the time and we may not notice them from day to day.
Sure. I'll take a slightly different path than you might think to answer that. If you look at how EPA and the Clean Air Act define air pollution, it's with 6 criteria pollutants primarily, and that's particles, it's ozone, it's lead, it's carbon monoxide, it's nitrogen oxides and sulfur oxides, and those all have a range of health effects and or environmental effects, some including death, which is what I alluded to earlier. But what we see, if you look at particles specifically, and if you look at ozone specifically, which is where we spend most of our time and money and energy in the U.S. focused on air pollution, you see a range of health effects. Death, okay, with particles specifically, but all the way down to decreased respiratory function. I'm just not breathing as well. Maybe a little bit increase in cough or phlegm or irritated eyes, some sort of soft symptoms but real. Maybe increased emergency room visits for asthma or even cardiovascular or respiratory outcomes. Bigger, absenteeism in school, missing days at work, chronic obstructive pulmonary disease, asthma exacerbation, and it goes right up to where we can measure increases of death at population level studies that look at many people and look at low levels. We might even see here outside in Athens today, small increases in air pollution that if you look at enough people, you see deaths. And then again, the first study for this really comes out in 1993, and it changes how we define this. It's called the Harvard 6-City Study. And what they look at 6 cities across the northeastern U.S., and for the first time they show, if you look at minor increases in background levels of air pollution across normal cities in the U.S. with population level data, you see for maybe a third increase in air pollution, a 1% to 3% increase in cardiovascular and or respiratory deaths. And again, that sort of puts this all on the landscape where we pay a lot of attention to it.
Well, let's look at some of the numbers worldwide or in the United States using Environmental Protection Agency data. What kind of impacts are we seeing over years of time?
It's a great question. So EPA, because now the Clean Air Act is over 40 years old, they've spent a lot of energy in the last years trying to estimate the impact, the positive impact of the Clean Air Act. And one number they put out at their 40-year celebration was they estimated in the first 20 years of the Clean Air Act a reduction in 200,000 premature deaths. So that's a substantial improvement in health in the U.S. based on the Clean Air Act and its effectiveness at reducing pollution.
So we've even had similar successes in indoor air pollution as well.
Right, so indoor air, I'm going to shift to the developing world where right now we're at the front stage of a global program called the Global Alliance for Clean Cook Stoves, where this was introduced by Secretary of State Clinton in September 2010, and with the objective, with the infusion of $50 million US across agencies, and the goal of installing 100 million stoves by 2020. And what the impetus behind all that is this numbers coming out of the these numbers coming out of the WHO that say we've got on the scale of 2 million deaths a year from pneumonia in children under 5 from smoke, from stoves inside homes. And that's the challenge that the global community involved in this stove research is tackling right now, is to address the problem that's not been really studied until now. We know an awful lot about health effects from low levels of air pollution, thousands of studies across the world in the last 3 decades. We know an awful lot about health effects from high levels of air pollution, from tobacco over the last 3 or 4 decades. But these levels for women in the developing world and children in the developing world are somewhere in between those two. Very few data points, a lot of science that needs to be done, and a lot of public health gain there if we can make some impact.
Give us some specific examples now in the developing world. Which countries are we talking about where we're actually seeing really some evidence of the impact that this indoor air pollution is having and the attempts to correct it?
Yeah, that's a great question. There's only one published study on this. It comes out of Guatemala. It's called the Respire study. It's published last year, November of 2011 in The Lancet, and it's the single study to look at pneumonia, including deaths by pneumonia related to this exposure. Now, outside of that, there's been studies all over Africa, all over South America, China, India, other parts of Asia, but not great data. Good data at assessing what the exposures are. We can, through risk assessment, estimate what the impacts of those are, but not good data yet to show much in the way of health improvement, except for this one study called the Respire study, led by Kirk Smith out of Berkeley in Guatemala.
Now, I understand now that one of your students here at the College of Public Health at the University of Georgia is actually doing hands-on research with cook stoves in Peru.
Back when I was in graduate school, I had a chance to do a project like we described in Guatemala, and it was a wonderful experience. And I've tried to create those sort of opportunities for my own graduate students. And I've had a dozen or more students go over the years. The latest is Adwa, who you'll meet in a moment. Adwa did a project in summer 2009 where she spent the summer in the northern Andes she did a fantastic job measuring exposure to air pollution inside homes and with women and children in relation to several different types of stoves as part of a much larger project. And I'll let Adwa tell you about that.
Okay, well, we're going to go now to some cutting-edge research then in the real world up in the high mountains of the Andes. So we have Adwa Commodore with us now, a graduate student here at the University of Georgia in the College of Public Health. And I'll have to tell you, I'm excited about hearing about this front lines research that you're doing there in Peru. Tell us how much of a problem that is there in the Andes, up in the high mountains there in Peru.
So in Peru, it's estimated over 90% of the rural population use biomass as fuel for cooking. This is specifically mostly wood, and it's different types of wood. Sometimes too, it's not just cooking, it's for heating also. And when there's incomplete combustion of biomass, you have your indoor environment within the households being polluted, and you have indoor air pollution. And mostly the reason why this is such an important issue is you have women and children who are in the thick of this for anywhere from 3 to 7 hours each day. For the women, it's because they're cooking, but for the children, it's even more important because they're at a young stage, they're developing, they breathe more per body mass compared to an adult. And then also if the woman is pregnant, well, then the fetus is getting this exposure. And another way the most cost-effective way, really, I should say, of removing such a problem is introducing chimney stoves. And right now, Peru, 2 years ago in 2009, they announced a national campaign for smokeless Peru, that's what they called it, and basically introducing 500,000 stoves by the end of 2011. And as of now, they've installed a little over 50% of that amount.
Tell us about the methods then. How would you go about trying to change such a dramatic impact on indoor air pollution?
In 2009, when we went there, we were invited to join an ongoing study. And basically, they wanted to characterize cook stove related wood smoke in the indoors of these homes. And they had 500 homes. They had 250 of them that had these stoves that the study was promoting, and then 250 that didn't have, they had all kinds of stove, including an open fire stove. So we went in there with our tools, exposure assessment tools, basically to characterize this smoke indoors and the personal exposures for the mothers, and then for the children in the homes who are under the age of 5. And then we also took measurements in the kitchen for a 48-hour period.
So what was the outcome? You measured, some representative samples of these thousands of homes. What happened? What was the difference between these introduced stoves and these wide variety of stoves?
After we measured and we were looking at our data, we realized we did not see any statistically significant differences between the stoves that had been installed in the 250 homes, and then when we compared them to all the other stoves that were in use in the region. And we later on, when we went through and then realized on the field, some of these stoves had not been installed properly, some of them were not maintained properly, some of them were not used exclusively. There were a whole host of reasons, and most of it was mostly repair and maintenance, and then exclusive use. If you're not using your stove, well, then your pollution measurements are not going to go down.
Well, that's real world research. You get out there and you try to set up an experiment, and then you find out there are more variables than you ever expected. That's real research. So what does it mean for the future? Where are you going to go from here? You've seen certainly how to measure this now. Where are you going to go now?
It's a great question, and it's probably an issue that's being debated right now, because really we want the best exposure assessment methods where we know that we've looked at a stove that was either, badly or greatly designed. You're able to accurately measure what a person's exposure is.
Well, thank you very much. This is exciting work that you're doing, and is a real good indicator that information is power. And I really appreciate this frontline research that you're doing, and the difficult nature of it. Thank you, Adjua.
Thank you for having me. It's a pleasure.
So now we're being joined by Femi Adetona, who's doing postdoctoral research here in the College of Public Health. Femi, thank you for being with us today, and we're going to make the shift now to kind of the outdoor air pollution issues. But tell us how you came to be here. How did you wind up in air pollution research?
Oh, well, I have a background in environmental management, and I have also a background in chemistry. And I was interested in applying what I'd learned to human health. And so my interest in air pollution began to develop. And since I wanted to do a PhD, I decided to find a program to plug in and do air pollution research.
It's great to be in a field where you're interested in making an impact. Tell us about this research now in the air pollution and the great outdoors here. Tell us about the populations that you're studying.
Well, I'm particularly looking at a specific type of air pollution, which is occupational exposure to wood smoke. And this is firefighters who are exposed to smoke from forest fires. So these are forest firefighters working to fight fires or doing controlled burns. And so because of the type of work they do, they get high levels of exposure, and this is what I'm particularly interested in.
So explain the difference now. So you have these firefighters that are right up on a fire. How's that different from the community, the people that their homes are being threatened and the community exposure to fires?
For the community, it may just be, like a once in a lifetime experience, but for these firefighters, because that's what they do, they get exposure, more frequently than the average population will do. And they probably get more exposed over an extended period of time compared to the general population. And also, I mean, if you're looking at the health effect of their exposure, the forest firefighters are typically a healthy population, and the effect you will find with them may not be as immediate as what you will find on the general population.
So this is what they call the healthy worker effect.
Yes.
You have these healthy men and women that are quite different from the regular population. Is that what you're referring to?
Yeah, that's what I'm
Yeah, the
talking
healthy
about.
worker effect. What are the implications of these challenges? What has your research really shown that's different about these populations? What impact has happened to these firefighters?
We don't particularly have a whole set of data to know what levels these people are exposed to. So there have only been a few studies to characterize the exposure of this population. And prior to us doing our own studies, most of the exposure studies that were out there were done in Western United States. And so we decided to do a study here in southeastern United States where the composition of the vegetation or the type of vegetation they have is different, and where, you know, a lot of times they don't have wildfires here, at least not as much as what they have in Western United States. But what they do a lot in southeastern United States is what you call the controlled burns or prescribed burns. And so you want to actually measure their exposures and learn exactly what they're being exposed to. So that's the place where we started. And what we actually found out was there were similar levels of exposure. I mean, the levels of exposure were similar to what people in, or the forest fires in Western United States had.
You've done an exposure assessment then, and you know the relative exposures. Here in the southeast is similar to what out in the west. Are those levels that you're saying, are they associated with health effects normally?
Well, in the general population, yes. And as a matter of fact, during big wildfires, studies have observed increases in visits to emergency rooms, visit to doctors due to respiratory diseases. So you're talking about people who have asthma, and then there's, you know, an increase in their symptoms. You are talking about people who have chronic obstructive pulmonary diseases who have to visit the doctors because they have, you know, increases in their symptoms. But we must keep in mind that these people are a healthy worker population, and so you may not as quickly see those effects amongst them.
Tell us, Femi, you're a scientist now, and what do you expect to see? What do you think is going to be? I know you're speculating now, but you've had some opportunity to observe these populations and to look at the exposure assessments. Are there dangerous outcomes that you might expect to see with this?
Well, we've done a few studies, and one of the studies we've done was to look at how well the lung functions amongst this population. And we didn't see an immediate effect, but the results of our studies suggest that there may be a longer term effect. And because of that, I mean, we may want to do a study which looks at the firefighters over the longer term to be able to conclusively say whether or not that exposure has a longer term effect.
Well, it's really exciting. I'm glad to see the work you're doing. It's frontline research, no doubt about it. Thank you very much, Femi.
Thank you very much for having me.
Now joining us is Dr. Dr Veena, professor and head of the Department of Epidemiology and Biostatistics here at the UGA College of Public Health, and a frequent guest here on PHI, Public Health Impact. Dr. Veena, thank you for joining us. You know, early in the program we heard about these pretty specific aspects of air pollution. Of course, what we'd like you to do is what you do best, is show us the big picture in public health. Why don't you give us a global eye view of where we're standing with air pollution and the effects, the outcomes of it?
Well, air pollution is one of the major contributors to disease and death worldwide. in the United States, we realized this in the early 1960s with the environmental movement, and we made dramatic changes in air quality. We set air quality standards and made dramatic changes in how we deal with uncontrolled pollution from power plants, open combustion of waste, and car emissions, so the controls on cars. So that has resulted in dramatic reductions of air pollution here in the United States. However, we still have issues with regard to power plants and increased number of automobiles, leading to a different type of pollution, which are the small particles and other contributors to outdoor air pollution. And indoor air pollution has become more of a concern here in the U.S. And just recently here in the United States, and I'll talk about globally in a second, but here in the United States, the Environmental Protection Agency just came out with new standards for mercury and air toxics, and in particular addressing the coal-fired power plants in the United States. And it's estimated, let me get the figures here, it's estimated that 11,000 premature deaths, 4,700 heart attacks, and 130,000 asthma attacks each year will be prevented by these new controls on coal-fired power plants in the United States.
You know, it's very interesting because now you're getting this dynamic between public health impact and the economy. You know, because there are a lot of people that are saying that these new standards will actually end up shutting down coal power. At least that's what's being said on some. In some
yeah,
quarters.
but the EPA has made it very clear and has stated that the technologies are available, and in fact it won't hurt but will help the industries. And also the big kicker in this is that in Georgia alone, 500 premature deaths will be prevented and $4.1 billion in health benefits in 2016 once these new pollution measures are put in place. That's just in Georgia alone.
Yeah. There are many impacts all around from these air pollution outcomes.
Worldwide and globally, the response from the public health community has been trying to, again, export these control technologies to developing countries. And as part of that, the World Health Organization in 2005 and 2006 has set worldwide standards for air pollution that these developing countries can try to meet. But nonetheless, there are still many countries throughout the world, major urban centers, both in Asia, Latin America, and Africa, that really have very severe pollution problems that are similar to what we had in the 1950s and 1960s. So very severe problems in these countries and in these cities, including Beijing, Karachi, Cairo, in different parts of the world.
We see, decreasing, levels of air pollutants allowed in some American cities, but then they either obey that or they don't, and then the same thing's going on internationally. What do you think the outcome's going to be over the next 10 years?
Well, I think the new EPA standard and the continued refinement of that, based on the research that is continuous and is done, is that helps set the standards to say we need to set levels and monitor that and reduce those levels. And so I think this new mercury and air toxic standard is an example where it's, by 2016 we'll have reduced significantly the amount of pollutants that will affect people here in the United States. Worldwide, again, it's continuing, the World Health Organization is continuing in its efforts to control outdoor air pollution. And of course, the other impact is worldwide implementation of clean cooking stoves for that huge part of the developing world that needs to reduce the amount of indoor air pollution.
So my final question is, how optimistic are you? Let's have your prognostication here going out. It's so hard to know the future, especially in the current climate that we're in now. But what do you think over the next 20 to 50 years? Where do you think we're headed with this?
I'm optimistic, and I think that's our duty as public health professionals, is to communicate that and to continue to help generate knowledge and communicate that knowledge so that these policies can be put in place. And the more that we can communicate that, then I think, and a good example again are the new standards here in the U.S. are based on epidemiology studies, environmental health studies that are done that really have documented the impact that these pollution levels can have. And so I'm optimistic that the more we can do that and communicate those things, that we'll be able to really have a big impact both here in the United States and globally.
And that's what we're after, is to have an impact and improve people's quality of life here in the United States and around the world. Thank you, John.
Mm-hmm.
So thank you to all of our guests today for telling us about this very important topic, the air we breathe.
Very interesting to see the difference in the problems we see in America, where most people think of air pollution as coming out of smokestacks, whereas in this country, in Peru and in others, the worst air pollution exposures they were getting are right there in their own home.
Yeah, and it shows you that one set of air pollution problems here in the U.S. may be very different than the air pollution problems they face elsewhere.
Yeah, and the outcomes, though, can be the same. Very negative impacts on public health from the air that we breathe.
So we'll see you next time on PHI Public Health Impact.